Have you been in a T-bone car accident? Here's why you should get checked, even if you feel fine. The hidden injuries of side impact collisions, presented by Soft Touch Chiropractic, by Dr. Masood Shamaizadeh, DC, serving Porter Ranch, Northridge, Granada Hills, Chatsworth, and the San Fernando Valley. A T-bone accident can cause serious injuries. Side impact collisions, commonly called T-bone accidents, are among the most dangerous types of motor vehicle crashes. Unlike rear-end collisions, where the body primarily moves forward and backward, a T-bone collision causes the body to move violently from side to side. This creates unique stresses on the neck, spine, shoulders, ribs, pelvis, and supporting soft tissues. Even when there is little damage to your vehicle, or you initially feel okay, your body may have sustained injuries that are not immediately apparent. Many accident-related injuries do not become painful until hours, days, or even weeks later. Why side impact collisions are different? During a rear-end collision, the neck experiences a rapid forward and backward motion, known as whiplash. Although whiplash can be painful and debilitating, the anatomy of the cervical spine provides some natural limits that help restrict excessive backward movement. During a side impact collision, however, the body has far less natural protection. The head and neck are suddenly forced sideways, while the torso may remain restrained by the seatbelt. This places significant stress on structures that are not designed to absorb large lateral forces. As a result, side impact collisions can produce injuries throughout the entire musculoskeletal system. Common injuries after a T-bone accident. Following a side impact collision, patients may experience whiplash injuries, neck ligament sprains, muscle strains and spasms, facet joint injuries, spinal joint dysfunction, shoulder injuries, rib dysfunction, mid-back pain, low back injuries, pelvic imbalance, disc injuries, nerve irritation, headaches, dizziness, reduced range of motion. Many of these injuries are not visible on the outside and may not produce immediate pain. Why pain doesn't always start right away? Immediately after an accident, your body enters a protective survival response. Your brain releases natural chemicals, including endorphins, enkephalins, and adrenaline, that temporarily reduce pain and help you function during a stressful event. While these chemicals are helpful in the moment, they can also mask injuries. Once these natural pain-relieving chemicals begin to wear off, inflammation develops and symptoms often begin to appear. This delayed onset of pain is one of the primary reasons chiropractic evaluation is recommended after a motor vehicle accident. Hidden joint dysfunction can be easily missed. After a collision, the muscles surrounding the neck and spine often become extremely tight. These protective muscle spasms help stabilize injured tissues, but they can also hide underlying joint dysfunction during the early stages of healing. Without a thorough examination, injuries affecting spinal motion, soft tissues, and joint mechanics may go undetected. Over time, untreated dysfunction may contribute to chronic neck pain, persistent headaches, shoulder stiffness, decreased flexibility, muscle imbalance, joint degeneration, reduced spinal mobility. Early evaluation helps identify these problems before they become chronic. Why chiropractic evaluation is important. A chiropractor performs a comprehensive examination to evaluate spinal alignment and motion, joint function, muscle injuries, ligament damage, posture, neurological function, range of motion, areas of inflammation. The goal is not simply to treat pain, but to identify injuries that may interfere with normal movement and healing. Early care may help reduce inflammation, restore normal spinal motion, improve joint mechanics, reduce muscle spasm, promote healthy tissue healing, improve overall function, decrease the risk of long-term complications. Don't rely on pain medication alone. Pain medication can help reduce discomfort, but it does not correct the underlying mechanical injuries caused by a collision. Medication cannot restore normal joint movement, improve spinal biomechanics, correct soft tissue dysfunction, address restricted motion, improve muscular coordination. Treating only the symptoms may allow underlying injuries to persist. A comprehensive musculoskeletal evaluation can help determine whether additional treatment is appropriate. When should you see a chiropractor? Schedule an examination if you've been involved in a T-bone accident, even if you feel well, especially if you notice neck pain, headaches, shoulder pain, mid-back pain, low back pain, tingling or numbness, dizziness, difficulty turning your head, stiffness, pain that appears several days later. The earlier injuries are identified, the better your chances for a successful recovery. Schedule your post-accident evaluation today. If you've been involved in a T-bone or side impact car accident in Porter Ranch, Northridge, Granada Hills, Chatsworth, Reseda, North Hills, or anywhere in the San Fernando Valley, let our team help you determine whether you have injuries that require treatment. Soft Touch Chiropractic, Dr. Masood Shamizadeh, DC 11145, Tampa Avenue, Suite 14A. Porter Ranch/Northridge, CA 91326. Call today, 818-831-0100. Don't wait for pain to tell you something is wrong. Early evaluation after a T-bone accident can make a significant difference in your recovery.